We're going to start with a great CII CPAR story from a physician champion, and I'm going out of PowerPoint mode so that it'll play better. But this is a really great story we captured from a physician in the Edmonton zone, and it really speaks to the provider and patient benefit of participating in CII CPAR.
So, the big question is, what difference has CII CPAR made to me and to my patients? So I wanted to tell you a recent story. Around New Year's, I received an e-notification that a patient of mine had been discharged from emergency. And at the moment, depending which hospital they've been at, you sometimes don't get a lot of information. So all I knew was that he had been to emergency and he was discharged, and the diagnosis was an upper respiratory tract infection. And I went on NetCare, and it didn't have the emergency report yet. And there was no mention of any lab tests or chest x-rays or anything. So I had not much to go on, but he's elderly. So I gave him a call to see what the story was. And what he told me was that he went to emergency because his common law partner was in the hospital with a very serious case of COVID, and he was worried that he had COVID and he was having difficulty breathing. But when they checked him in emergency, he was his oxygen level was pretty good, and they felt that he could manage at home. So that allowed me to check later that day for his COVID test result, and sure enough, it was there and it was positive. So then that allowed me to activate the COVID pathway and go through with him and phone him every day, because he was 77 years old and had hypertension and a couple other conditions. And I could check every day and see how he was doing, and had given him kind of red flags to watch for. But also, as it turned out, unfortunately, his common law wife died of COVID. So I was also able to provide emotional support. And I think that was very useful to him, especially because he was isolated with COVID. He couldn't have family members coming to see him and so on. So he looked forward to that phone call every day. So the bottom line is, I would not have known that he had gone to emergency unless he had contacted me himself, because I didn't get the emergency report for about another 10 days. And I wouldn't have gotten a copy of that COVID test result because it was done in emergency and didn't have my name on it. So that's just one story amongst many that myself and my colleagues can tell you about what a difference CII CPAR makes to our patients and to us.
And we'd like to thank Dr. Janet Craig for sharing that with us. And she is a physician champion in the Edmonton zone and Edmonton West PCN. Actually, before we go, any comments on that? Okay. The key is, it was about early connection of information about the patient for Dr. Craig. And really, that is what CII CPAR is able to do. So she shared with the system who her patient panel is. And Sarah Joy, I think there's one person, maybe we could mute that. Because...
Yeah, absolutely.
Okay, thank you. So she is able to share her patient panel with the system. So CPAR knows it and CII knows it. And because the patient is registered to her in CPAR, that is what enabled the e-notification to go back into her EMR to inform her that he had been discharged from emergency. Same thing though, if a patient is discharged from hospital, day surgery, or admitted to hospital, physicians receive that notice. And something that actually coming up later this year is physicians will receive a notice if their patient went to emergency and left without being seen, because physician advisors told us that they wanted to know that as well. Whoops, that is not what I intended to do. There we go. So CII CPAR allows the providers to share their panel, their encounter data, and if they are a provider that writes consult reports, they can share those with Alberta NetCare as well. What they receive back are the e-notifications if the patient's discharged from hospital emergency, admitted to hospital, or day surgery. They receive back conflict reports if they have a patient on their panel where the patient said yes to another panel, and something called demographic mismatch reports, which tells them if their patient is deceased or their demographic information is not matching with Netcare. What Netcare receives to be enhanced are the community encounter digest from participating offices, consult reports from community providers, and starting in June of this year, Netcare will display the name of those primary providers in Netcare so that the system knows it and people can look it up in emergency or hospital. And a new piece that's under development is the patient summary, and that's on the plan for the fiscal year coming up, which is quite exciting. So again, after the patient summary and the identity of the primary care provider in Netcare will be those patient summary reports. And I wanted to show you that they will also flow to My Health Records, where the Albertan will have a copy of it as well. So it's not just between the provider and the system in Netcare, but the patient can receive a copy for their use as well, again, for more continuity of care. So January 2021 and up to the very beginning of February, where are we with deployment in CII CPAR? Last week's deployment report was showing that we have 524 family physicians or general practitioners fully live on the system and 226 in progress. On the specialist side, we have 101 fully implemented with 162 in progress, and in total over 1,000 physicians in Alberta from the process of confirmation of participation form or commitment to participate onward to being fully live. And when we look at that, I don't know why that came out.
And actually, Barb, I have a question in the chat here from Rhonda. So she's asking, do you know if ambulance records will be counted as a community encounter?
An ambulance record. So the ambulance records would not, the source of that information would not be from a participating community clinic. It would likely be within Alberta Health Services. So it would not be a source through CII CPAR. And I don't know the plans with Alberta Health Services and Connect Care if they plan on having ambulance records as part of the Connect Care record, which is all within Alberta Health Services. But good question.
Thank you, yes.
So whereas I just showed you the physician deployment, this is clinic deployment, and because this is an EMR user group, I broke it down by EMRs. And on the left-hand side here, on the various stages, we have 49 clinics with MicroQuest Health Quest, 32 clinics with QHR or Curo, 86 MedAccess, 16 PS Suite, and 50 Wolf clinics. Of those 50 Wolf clinics, 32 are fully live. 2 are in progress right now, and another 16 are in that confirmed stage, getting ready to go into being live. So some key results of where we're at as of the end of January. 260,000 Albertans have something called a community encounter digest in their Alberta Netcare record. And almost 100,000 consult reports sit in Netcare as a result of physicians submitting through community information integration technology. So this is really connecting the system more, and we know that those community encounter digests are connecting primary providers in the community and emergency doctors, and we have a story coming up of that actually. Where are we across the province as of the end of January? This shows a distribution of all clinics, both primary care and specialty, across the province that are deployed and live on CII CPAR, and that's 131 clinics. 89 are PCN affiliated, one's a nurse practitioner clinic, and 41 are specialty clinics. So they do occur across all zones. And the most are 42 clinics within the Edmonton zone, followed very shortly by 41 clinics in the Calgary zone. When we look at the distribution of those clinics where we have physicians affiliated with a primary care network, this shows that distribution at the end of January. And again, across all zones, there are clinics implemented, and the big zones of Edmonton and Calgary have the most number of clinics implemented. But when we look at actual individual physician participation, this shows here physicians and their affiliation to a primary care network. The top area is the Calgary zone, which is the largest zone by population of physicians. And there's 154 physicians in progress and 131 live of a potential 1,593 in the Calgary zone. And you can see the distribution for all the other zones across the province, showing the live, in progress, and then the potential to fully implement. When we look at it at the relative goal that we have provincially of 80% implementation, and I'll add a little qualifier on that. This shows the relative implementation at the physician level by zone based on the total amount that there is to implement in the zone. And of course, the Calgary zone and the Edmonton zone have the largest number of physicians to implement, but lots of progress across all zones. And overall, which is really exciting, is that we are on target to where we want to be. So this next two slides are actually very important, showing the clinical implications of CII CPAR. So this is CPAR data. So CPAR data are only the panels going to the Central Patient Attachment Registry. In the month of January 2021, there were 446 primary providers. So these were pediatricians, nurse practitioners, or family physicians that submitted their panel to CPAR. Of those, that with their patient population, there was 362,000 Albertans in the database with their associated relationship between them and their primary provider. So what this enables to do is the system now knows that there's this established relationship between this patient and this primary provider. This enables e-notifications to go out, which is the story we heard from Janet Craig. And this is a graph showing actual e-notifications that were sent out across the province between July 2020 and January 2021. With each month, with more participation by primary providers and their associated patients going into the database, there's more potential for connections. In January of 2021, there were over 12,000 notices that went out, just like the Dr. Craig story, that went into EMRs of participating primary providers because they were participating in CPAR. And these are opportunities for transitions of care when those patients were either discharged from emergency, hospital, admitted to hospital, or day surgery. So this grows every month. And this shows you as well the distribution by each of the zones. I know it's small, so I'll show you this blue is South Zone. This yellow is North Zone, followed by Edmonton Zone, Central Zone, and Calgary Zone. I'll be really quick here because time is ticking along. This shows the implementation progress based on a provincial goal of 80% participation. And this is where we sit. We are actually, if you look at the diffusion of innovation, we are moving from the early adopters into the early majority on a provincial scale. So that's an exciting point provincially that we are moving along. And this again shows us that we are just about crossing that valley of death as we move over. And a number of zones have already crossed that, but provincially we're getting quite close right now. Here is another story from Dr. Joseph Ajetican. Sergio, I know you know this story too. Do you feel like sharing it, or would you like me to share the story?
Sure, I can share it. Yeah, absolutely. So first, this is a quote by Dr. Ojedikin. So Dr. Ojedikin is from the North Zone, and we've seen quite a bit of uptake in the North Zone. So he says, studies have shown that continuity of care is the single most important intervention that, when offered to patients through timely access, can reduce mortality by up to 50%. So that's quite a statistic right there. And he says, as enablers of continuity of care, CII, CPAR, and e-notifications are, in my opinion, the best things that have happened to primary care in Alberta. So now we'll take a look at this story here. And sorry, I just have to pull up my notes here. Okay, so Dr. Ojedikin had a young woman as a patient, and one day she had a hemorrhagic stroke. So she ended up going to the hospital, ended up in the surgical ward. When she was there, they found that she had really high blood pressure. The thing is, the attending physician couldn't figure out why. So the attending physician looked into NetCare, and he found, because Dr. Ojedikin was part of CII CPAR, he was able to see in NetCare that Dr. Ojedikin was the patient's family physician. So seeing that allowed him to call Dr. Ojedikin and say, "Hi, why is this patient's blood pressure so high? It doesn't make sense. They just had a stroke." So Dr. Ojedikin, knowing the patient and having information on the patient that only he knew, was aware that the patient had a crystal meth addiction. And so that explained the elevated blood pressure. So without that information, the attending physician couldn't have possibly come up with the best treatment plan for that patient. But thankfully, they were given that information. The patient was given a new treatment plan, and they improved as a result.
Yeah, thanks for sharing that. And that story occurred early in Dr. Jedikin's CII CPAR experience, actually before e-notifications were enabled for his EMR, which happens to be Wolf as well. But it was the Community Encounter Digest that made that connection from the hospital to the primary provider. So we do have a provincial adoption goal, and that is, and it has been refined late last year, that 80% of community physicians using a conformed EMR, because you need to be on a conformed EMR to use CII CPAR, will adopt by May 2023. And right now, provincially, we're on target to achieve that with the influx of physicians signing up. So now we're going to dive deep into more about Wolf and CII CPAR now that we have the overview. One of the key resources that should be useful for you is that we do have an orientation presentation that is available for download on our website. It's a PowerPoint with notes in it that you can use to explain it. And I recognize it's a big PowerPoint, but you can cut it up and use the pieces that you need when you need it to explain it. As well, we have a video that we recorded that explains the mapping that occurs between the Wolf data elements and CII and CPAR. Those are really useful tools. As well, TELUS created a user guide. It's an online guide that's also downloadable as a PDF that explains the very detailed ins and outs. So let's talk about some Wolf tips, and we'll start with the demographics. So the demographic fields that flow to the central patient attachment registry include the not surprising demographics of name, PHN, date of birth, and gender. And it will include the primary service provider, which is the patient's panel provider. So once the physician, nurse practitioner, or pediatrician signs up, then it is that field, this one right here, that CPAR pulls from to inform the system that this provider and this patient have the established relationship. And CPAR needs the other data to make that patient identity match. The other important points are that every patient needs a last visit date to flow to the Central Patient Attachment Registry, as well as the patient data verification has to have a date and a check mark in there. And this date also reflects out to other providers on the CPAR panel conflict report. So if that patient happened to say yes to the panel question at more than one clinic, then the two clinics will see, well, this is the last date they saw me and the last date we verified with this patient. And the other clinic sees the same information as well. So it allows that coordination of really, we need to ask this patient who they consider to be their primary provider. There are some tips in the user guide before go live that are important. These are one-time setup steps that somebody in the clinic performs that has administrative privileges. And that includes accepting the terms and conditions of TELUS EMR Mobile. And it's not that the clinic needs to be using EMR Mobile, it's just a connection that needs to be there for TELUS to set it up. There's some configuration at the individual physicians with panels that needs to be set up. Those that are participating need to know the mapping, and Sarah Joy shared the video that's available that explains in detail the mapping between the fields in Wolf and CII and CPAR, and also how to understand how not to send information if the clinic wants to keep information private. And I'll get to that in a moment. At the CPAR level for panel, every patient has to have a status that has been configured to go to CPAR, and that's a one-time activity as well. They can't have a blank. Now, we do know that Wolf has been around a long time, and we have had clinics using it for at least over a decade, and actually I think some of them could be close to 2 decades. And depending on how you started off, paneling might include patients, the office patients might have no statuses. And there haven't been many clinics like that, but if that is happening, you're gonna have to redo what your statuses mean, because a patient needs to have a status that is configured to go to CPAR. The other important point, I'm gonna reiterate this a couple times, is running your panel list. You need to do it the first month before you go live. And you're going to do it monthly. And the reason being is the clinic needs to know on a monthly basis how many patients are going up. Because TELUS has automated the process, you need to just run your list based on the conditions that you've set for patients to be paneled. And then TELUS automatically uploads it to the registry every month on the 12th of the month. And so it's a ideal practice that the clinic is running their list, and they would know for Dr. Blue that their panel is 1,221, and then they would expect 1,221 patients to load up into CPAR. But they don't know that unless they run the list. There also is an early one-time configuration step. Late before go live, the clinic gets what's called a panel number for each physician or nurse practitioner or pediatrician participating in CPAR. And their panel ID number gets entered in a spot in the physician area. And the guide shows the clinic how to do that. So I want to get back into panel tips because we've had a couple clinics stumble on this process. So the first is that every patient has to have a status. And so you would see that in patient maintenance, what that status is of the patient. There's also a one-time configuration activity I mentioned by the clinic administrator. And each clinic chooses which statuses mean that they're a CPAR patient. And it could be office patient, and it could be something like even the long-term care patients. Those are the two groups that are paneled to a provider. Depending on how you do statuses at the clinic. And we know that there's customization available in Wolf to do that. So this is an individualized practice at each clinic. But one person that can configure it needs to understand the connection between this and CPAR. Also, there has to be communication with the people running the list so they know what statuses are going, and of course the front office team that is doing the panel work. So before the first upload, and then every month run your list. So once you create that search, because it's going to be a custom search for your clinic, because it could be the status of office patient and let's say long-term care patient for a given doctor that does both that types of practice out of the clinic. And so you run your list, you create that search and save it, and then run it every month. And you'd have that panel list for each provider. And then you would know, well, this month it's 1,121 patients, and next month it's 1,115, depending on how many patients came on or off the panel that month. And again, on the 12th of the month, those panels go up to the Central Patient Attachment Registry. The reason there is this extra dates is the system was built that if TELUS had a technical problem, they have until the 21st to finish their work. And then on the 22nd, the Central Patient Attachment Registry starts doing all that matching between right now over 35,000 patients that are in the system. Then on the 2nd of the month, the reports go out to all participants, or they can, sorry, I'm going to change my words. The reports are available for all participating offices to download from CPAR and use them for panel maintenance activities. We've also made available, and this is on our website, a post-implementation checklist that serves the clinic team. If there's any changes, if a provider comes or goes, or other questions that you might have, this is a checklist that helps to support those activities. And what do you do? What are those next steps that you do take? And this is available for download on our CII CPAR webpage. So we just talked about panels. The second type of information that is exchanged through CII is encounter data. So there are some conditions for which an encounter must go. There's a new visit note. It's not marked as private. Of course, the patient has demographic data. Now, this patient doesn't have to be paneled to the participating physician, depending on the practice type that the physician has, or nurse practitioner or pediatrician. So if they run a walk-in clinic data goes to NetCare, to the Community Encounter Digest as well. Provider must be participating in CPAR, and then when they're done, they have to close and lock the visit, so it's done. And then that evening, CII knows that it can take it out of the TELUS clinic and send it up to NetCare, where it will be part of the Community Encounter Digest. So this is one of the slides from that PowerPoint deck that we were talking about a little while ago that gives an overview of all the fields that map to inform the Community Encounter Digest in NetCare. And a really simple rule we want you to remember is only information from those mapped fields go. So it's always a decision point for somebody that is documenting in the clinic. If they don't want that information to show up in NetCare, they can document it in a field that we use the word does not map. And if we look at a SOAP note, there's lots of text fields where there's opportunities to report information they don't want to share in those fields. So it's pretty simple once you look at it to recognize that it is pretty much fields that have standardized data entry that would flow to the Community Encounter Digest, like blood pressure, height, weight, that type of thing. So when we talk about keeping information confidential at the clinic, the first decision point is, oh, we just won't record it in a field that is mapped. And it's actually a useful tool. We have a couple of examples like this. They're printable resources on our website that you can print and put at workstations to remind a team of what fields do go to the Community Encounter Digest in NetCare, so that they're always informed to make those choices.
And Barb, I have a question in the chat here. Okay. So yeah, so someone's asking, can the visit note upload on a later date if they do not finish charting on that same day?
Yeah, that's a great question. It would go on a later date. So of course, we know that people don't finish their charting on the day of the visit. So it goes once the visit has been closed off. So good question. Yeah, they don't have to keep charting. They won't have to change their charting practices if they don't close the visit on the day of the visit. Okay, so this is just to highlight that if you're working with a clinic that is interested in CII CPAR, aside from the fact of not documenting in a field that maps to the Community Encounter Digest, if they want to keep a visit completely private, there are features within Wolf that enable that to happen. And there are details in the user guide from TELUS that explains how the feature works. I like to remind people that if you don't document that confidential information in a map field, that's the easiest way to keep it confidential. But if you want to make it like the visit never happened, you can do that with the confidentiality feature within CII CPAR, within Wolf itself. So we've talked about panels, we've talked about encounters. The next part are consult reports. So any provider that writes consult reports, meaning they get a request from another provider for a consult and they write a consult letter back. So this could be primary care providers, but it could also be a dietitian, for example, that is doing a comprehensive workup on a patient and they write a consult report. They can submit those to Alberta Netcare. And so when you're filling out the confirmation of participation form, you indicate if the provider wants to, but also has the ability to send consult reports. Don't click that box if it's like a future wish that they're not actually doing, because eHealth Support Services actually validates that it's working. So they need somebody that is actually generating consult reports. So for those providers that want to submit consult reports, there is, again, that little bit of configuration that happens one time at the beginning, and the instructions are in the user guide. But the report process in Wolf is a little bit different than the other EMRs if you are working with multiple types of EMRs, and it has to do with the document type in Wolf. So at the beginning, the providers that want to submit consult reports choose their smart form that they want to document on. If the case is that they want to duplicate it and have one that goes to Netcare and one that doesn't, that's a really good step. And all they need to do is change the document type of that smart form to consult report. Then anything documented in that smart form will automatically go to Netcare once it is complete in the clinic. So the visit has to be signed off associated with that visit as well, and then it will go that evening. But it's a fairly easy process in Wolf to send consult reports to Alberta Netcare. And this is just a reminding of the process and that it does have to be signed and logged. The other thing is the training we'll call it at the clinic, is anybody participating just needs to know that if the document type is not consult report, it will not go to Alberta Netcare. So last bit about Wolf and the technology are e-notifications, and I'll give you a little bit of a detail of what that looks like and how it works within Wolf. Again, the clinic would get this when one of their CPAR paneled patients has an emergency department discharge, hospital admission, hospital discharge, or day surgery. What CII does, it works with the admission discharge transfer system of Alberta Health Services, and it collects information twice a day at 6 a.m. and 2 p.m. and then routes it to go out into the EMRs. It comes into the EMR and it looks like it comes in similar to a lab report. So in Wolf, it comes into the investigation document in basket. What is really neat is they are the keywords 1, 2, and 3 are all coded so that you get at a glance information. If the provider has it configured that a team member that could be a nurse or another team member, has access to their lab reports. They can also see the e-notifications on behalf of the provider. This enables this to be team workflow, where a clinic creates protocol for actions of staff based on e-notifications coming in. So this is a blow-up close-up of the e-notification. So the document type is called notification. Keyword 1 will tell you what has happened. So it either says admission or discharge. And then keyword 2 tells you the facility that the patient was discharged from. And sorry, okay, let me just change that because I just made an error. So keyword 1 is admission or discharge. Keyword 2 will say inpatient or emergency, and then keyword 3 tells you the name of the facility. What I think is really cool about this is if you did want to do any quality improvement at the clinic, you now have coded data that you can do searches on to understand your patients, the volume of patients that have been admitted, discharged, etc. And you could do quality improvement work if that was your interest. Also, we talk about this with the home to hospital to home guideline coming out, that this EMR is really nicely set up for that quality improvement work for teams that want to do that. So they've been live for almost a year now. And once the e-notification is opened, you get the more detailed information. Again, it's super high level. Like I said, it's based on the code being in the Alberta Health Services system, being picked up and translated into this notice. So it's very high level information. It indicates the patient, the facility, the date and time. If they've entered it in Alberta Health Services, it will tell you the attending provider and the admission reason. If that patient is attached to more than one primary provider in the Central Patient Attachment Registry, it also tells you this information called additional providers notified. And that means that the patient has more than one primary provider in CPAR. And at this time, it's a really good opportunity when the clinic is communicating with the patient to identify who that patient considers to be their primary provider. Once the e-notification has been opened and closed, it remains in the patient chart in the document tab. So it's always there for anyone that needs it. Now, like I said, the information is high level. So the recommendation is for participants before you contact the patient is look in NetCare, because there's a time lapse between the time the codes are picked up and the clinic opens it and then makes that decision to follow up with the patient. Hours to a day have passed depending on the reason, and there likely will be additional information in Alberta NetCare, and then contact the patient. One area that it has been identified, and it's all based on the coding, and Alberta Health is working to improve it right now, is it doesn't necessarily, if it wasn't provided, the reason is there have been a couple cases where a patient has been deceased. So that is why we will always recommend that you look in NetCare first. An enhancement is in the build right now that it will show more clearly on the notification that the patient was deceased in hospital. Again, this would only show for patients deceased in hospital. If the patient is deceased through other outside of hospital, then the clinic would see that on the demographics mismatch report. Okay, that was the key stuff. So I'll pause there and see if there are any questions.
Okay, so I have a question here. So it says, do we know what data elements are going to be pulled to appear in the patient summary?
Great question. Actually, the clinical work group who is starting to work on the patient summary, the meeting is later this afternoon. So it looks like, to begin with, it hasn't been decided, which is good because it's still in discussion. The meeting's happening this afternoon. There's clinical advisors of physicians informing that. But it looks like it's going to be, of course, the demographic information of the patient, family history, problems, medications. I'm going to ask on the meeting this afternoon, is it going to include failed treatments? Is it going to include failed medications or non-prescriptive therapy that the patient could be on? So it's still unknown. It is on the development list for this coming fiscal year, starting April 1st, and that's why the work is starting now. But we anticipate that the patient summary is going to be the yin to yang of the community encounter digest. The community encounter digest is just meant to capture encounters that a patient is having across the system to form that picture of where they're seeking care and what that was for. The patient summary is meant to be a more comprehensive document from the provider and team that knows that patient the best. Again, should they end up in emergency or hospital, a provider there could look at them both and get a much more comprehensive picture of that Albertan than has ever existed in the past in the system.
Great, thank you. And does anyone have any experiences to share as well with clinics going on CII CPAR? Anything they think might help the group? Questions related to wolf sunsetting and going on CII CPAR, feel free to ask those as well, what the impact might be there.
Yeah, while people are thinking about that, I'm going to add in, because I was in contact with a couple clinics. They were going to transition, they were planning to transition to Med Access. Then they had their call from TELUS, found out that collaborative health record was going to be an option. They decided we're not going to go to Med Access because we're going to wait and transition from Wolf to collaborative health record, and we're going to start CII CPAR now. And they started the ball rolling on that because they wanted to be receiving e-notifications for their patient population.
So actually, Barb, what happens when, if say a clinic is on Wolf and they decide to go on CII CPAR and then they later have to migrate to another EMR, how does that work?
If it's a TELUS to TELUS migration, or yeah, that's the only vendor that we have that has multiple systems. They make a pretty good commitment to the client to migrate their data over. Of course, we haven't had any clinics migrate over to collaborative health record yet, so we don't know what that's going to look like. But they made that commitment. They also made the commitment when TELUS was telling Wolf clinics to migrate over to Med Access that they would migrate the configuration settings for the clinics. So that's a good question, if TELUS will migrate the configuration when a clinic is, let's say, moving Wolf to collaborative health record. I see a hand up.
It's just me, Barb, Diane Power. So I just am finding that it just knocked the wind out of people's sails. So I had, some of the people that were, already had their migration date. And then when they were told, oh, actually, we're going to wait right now. One of my clinics was told it's going to be about 14 months. And they were supposed to migrate in April. So now that everything seems to be up in the air, they're very leery. They're not interested in talking about CII CPAR. They're not interested in paying twice for a PIA, to get done. And so, because our PCN is paying for PIA updates for a transition, they don't want to do it now to be able to comply with the CII CPAR requirements, and then have to do it when they switch to an EMR. So I'm just finding that it really made everyone dig their heels in, which was really too bad, because I think some of that momentum would have carried forward to CII CPAR for my clinics.
Yeah, thanks for sharing that, Diane. And it's understandable. We're in this time of a lot of change in the environment. Add this on top of it, and I could see how it could take the wind out of their sails. And that's too bad. That's something that's difficult to influence. And we might have, like, once we start migrating clinics over and TELUS starts their first migrations to collaborative health record, we might see some benefit to being already part of CII CPAR. That's to be seen. Yeah, so there's, I'll speak quite frankly, there's another vendor and it's actually Connect Care. So there are some clinics that are moving with Alberta Health Services from Wolf to Connect Care. And what we've learned is that there's something in the background happening that it's going to make it easier for these clinics moving to Connect Care if they pull their panel out of CPAR rather than the clinic EMR. So that's just been a really interesting learning, that the migration was going to be easier that way. But maybe we will find a benefit, or maybe two, once things hopefully settle down a little bit, they'll have less change fatigue. And maybe we'll get some better indication from TELUS of what the timing is going to actually be like. So something else that we can share right now, Sarah Joy, is I do want to promote that because you've been the person behind this, we've made lots of edits and changes to the website. And the reason we want to share this is from an EMR perspective, if you're a Wolf user, we put everything in one place.
Good point, Barb. So we will be making additional changes to the website just to make it easier to navigate, but we'll point you to some of the new things that are on the website right now. So there's still the news page. There's a physician experiences page here. So this one is really good for engagement material. So it's broken down by, there's all zones material here, and then it's broken down by the 5 zones. And so we have PowerPoint presentations, just like the story we shared today with Dr. Ojedikin's story. There's tons more in here. So you can find those in the PowerPoint presentations. There's links to short articles. There are also audio clips. So the one that you heard today is here. There's other ones as well. I would say, yeah, look on this page. It's really good for engagement materials. The primary care tools page and practice facilitator pages, those are still the same, but stay tuned for additional changes to those. There's also a new CPAR panel resources page. So this one is really good if you have clinics participating in CPAR. It has all of those panel resources in one section. Did you want to add anything about this page, Barb?
Yeah, I'll just add too that we are thinking about the person that's going to have to play the role of the CPAR panel administrator. And that's where that person would find the resources that they would need on that page and that section called Tools for Active Panel Management.
Yeah, absolutely. And then we have an EMR resources page as well. So hopefully this helps you find all of the EMR resources you need related to CII CPAR much easier. So for example, if you're just looking for the Wolf ones, you can find anything related to Wolf and CII CPAR in this section here. So hopefully that helps you focus just on those. And then we have this FAQs page. So if you have any other questions after today's session, please go to this page because we've probably answered it here. So you can, these are all of the different sections, the types of questions you might have. You can expand them and you'll see that they have a whole bunch of questions underneath them. So if you're curious about perhaps other EMRs being compatible with CII CPAR, you can expand it and see the answer there. So this is a really good page also to point providers and other people considering CII CPAR too. It hopefully will answer most people's questions. And yeah, so stay tuned. What will happen eventually is we'll have a central CII CPAR page, and from there we'll have links to different resources depending on maybe the type of person that you are, if you're a practice facilitator, panel administrator, physician. If you're just looking at what do I need to do to get started, we'll have quick links to those kinds of things. So hopefully that'll make it easier to navigate the resources.
Yeah, and we also, if you have clinics that are mixed and contain primary care providers and specialists in the same clinic. We encourage them all to go together if they want to go right away. And if you need assistance with the specialists, we have a specialist page there, but we also have a contact there. It's at the bottom, CII-specialty, and you say like, I'm perfectly comfortable supporting the primary care physicians, but needs assistance with the specialists. Please use that link, and we have a team engaged at the program that supports specialist offices because they don't have practice facilitators.
Okay, so future meetings, here's what to expect. So March 17th, we'll be doing a quick update on wolf sunsetting. So if hopefully TELUS will have released more information before then and we can discuss that there. That'll be a quick 30-minute session with a Q&A. On April 21st, I wanted to do a discussion and sharing session where people can share the initiatives that clinics and PCNs are working on. So think specifically about those PMH initiatives that you might be working on, and then we can maybe connect you to other people who are working on the same one so you can share some tips and tricks there. And then we do want to do a session just as the COVID vaccine rollout is happening. So talk about some of the important panel processes that clinics should have in place for that. The date is still to be determined because we're still waiting for a timeline on that. So again, don't forget to post on the discussion board if you have any questions or comments or anything. You can also contact networks@albertadoctors.org. We have someone who is constantly monitoring that email so they can redirect you appropriately depending on your question or comment. So thank you everyone for joining. Thank you, Barb, for the awesome presentation and Q&A. And hopefully everyone learned lots.
Thanks for having me. Have a great afternoon, everybody.